Hi everyone, welcome back to my YouTube channel, and today we are going to talk about actinomycosis. So let's start our topic with introduction. Actinomycosis is rare chronic bacterial infection caused primarily by Actinomyces israelii. That is a gram-positive anaerobic bacterium that normally resides harmlessly in the mouth, throat and gastrointestinal tract. Under certain conditions such as tissue injury or poor oral hygiene, these bacteria can invade deeper tissue leading to infection. Actinomycosis is characterized by slow progressing abscess, tissue fibrosis, and formation of draining sinus tracts that may discharge pus containing sulfur granules. Causes of actinomycosis. First is bacterial origin, and it is caused mainly by Actinomyces israelii, though other species may be involved. Second is there are predisposing factors that predispose for actinomycosis that include poor oral hygiene, dental caries or periodontal disease, oral trauma or surgery, immunosuppression. Now let's talk about pathogenesis of actinomycosis. It is normally harmless bacteria that penetrate mucosal barriers, then it proliferates in deeper tissue and form chronic granulomatous infections. Types of actinomycosis. First type is cervicofacial actinomycosis, that is most common type. It involves jaw, neck and face, and it is often associated with dental infection. Second type is thoracic actinomycosis that affect lungs and chest wall. It may mimic tuberculosis or lung cancer. Third type is abdominal actinomycosis that involves intestine, appendix or abdominal wall, and it can follow surgery or trauma. Fourth is pelvic actinomycosis that is associated with prolonged use of intrauterine devices. Fourth is disseminated actinomycosis that is rare and it spreads to multiple organs through bloodstream. Clinical features of actinomycosis. First is cervicofacial form. In this form, there is swelling of face or jaw and neck. There is firm woody consistency of affected tissue and sinus tract discharging pus with yellow sulfur granules is there. Talking about thoracic form, in this there is chronic cough, chest pain and fever, and there is possible lung abscesses. Third form is abdominal form, in which there is abdominal pain, swelling and fear, and there is mass formation that mimics tumor. Fourth form is pelvic form, in which there is pelvic pain, abnormal discharge and fever. Diagnosis of actinomycosis. First we can do is clinical examination, that is presence of chronic swelling and draining sinuses. Second we can do is microscopy, that is identification of sulfur granules that contain filamentous bacteria. Third we can do is culture, that includes isolation of Actinomyces species, and it is difficult due to anaerobic growth of this species. Now, fourth, we can do imaging that includes X-rays, CT scan or MRI that help assess extent of disease and rule out malignancy. Fifth, we can do histopathology that confirm granulomatous inflammation with bacterial colonies. Treatment and management. First, we do is antibiotic therapy that include high dose penicillin for prolonged periods that includes weeks to months. Alternative for high-dose penicillin are tetracycline, erythromycin, clindamycin for penicillin allergic patient. Then we can also do surgical intervention, that is drainage of abscess and excision of sinus tract or infected tissue if necessary. We also provide supportive care that includes good oral hygiene and management of underlying dental or systemic conditions. Prognosis of actinomycosis. With appropriate antibiotic therapy, prognosis is excellent. Delay in diagnosis may lead to extensive tissue destruction, and recurrence in this case is rare if treatment is completed and underlying risk factors are addressed. Conclusion of this lecture video. Actinomycosis is rare but significant bacterial infection that often mimic other diseases such as tumors or tuberculosis. Early recognition, prolonged antibiotic therapy, and supportive care are essential for successful management. Maintaining good oral hygiene and addressing risk factors can help prevent the chronic condition. And this was all about actinomycosis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.